Okay, great. Very nice to be here with you all. Really exciting to be in the same room as some of my colleagues from the Institute who we've been, as was mentioned at the beginning, we've been having Zoom calls for a few years now as we set up the Institute, and it's really nice. I don't think we've been in the same room for a few years, so it's great to be here. So I'm at the School of Public Health, and I'm going to be talking about work that I do in general, focused on interventions that aim to improve child development outcomes in low and middle income countries. I'm going to talk about one specific project in South Africa. So let me just start with an overview of neurodevelopment in the global context. So one often cited estimate suggests that 250 million children under the age of 5 in low and middle income countries are at risk of not reaching their developmental potential. I think just a quick reflection on that statement. I think one thing to say is this 250 million number, it's a very crude estimate. It's based on essentially prevalences of stunting, sort of growth, sort of low height for age Z-scores, as well as poverty. Doesn't necessarily capture a much more holistic definition of child development. And this, this term developmental potential, I think it really reflects in some sense how the public health community thinks about or frames this issue of child development from a very deficits sort of based approach. I know part of what we talk about at the Institute is thinking more, adopting more of a strengths-based approach to thinking about child development. But just want to provide some context on how the global sort of public health community thinks about this. We know many of the exposures, many of them poverty related, that children in low and middle income countries experience that really can sort of contribute to or inhibit development. There's chronic malnutrition, there's stress, which has been talked about, repeated infection. So the good news is we do have a set of interventions, or there's a growing body of evidence that suggests that interventions can mitigate some of the effects of these early exposures, these early poverty-related exposures. I'll just mention WHO, UNICEF, and the World Bank recently published something called the Nurturing Care Framework, which is really an attempt to put together a definitive resource on the types of interventions, early childhood interventions, that governments and low and middle income countries should be thinking about investing in. So my own work really focuses on testing the impacts of early childhood interventions. A lot of it is focused on delivery platforms. So my expertise is not necessarily in, in the science of child development. My interest is very much in service delivery, health systems, trying to get services out to remote rural areas where low, sort of high poverty populations that would otherwise not have access to those services. I have one study in South Africa which aims to evaluate the impact of a community health worker intervention, actually following up on Emily's presentation. So this intervention aims to leverage the public health system that's already in place, reorganize the time that community health workers spend at the home with the families of young children, try to get them to focus a little bit more on child development holistically rather than just immunizations and nutrition counseling, which is traditionally more in the purview of the health system. So those things are still important, but try to expand the 30 minutes they spend per month at home, looking at talking to parents, supporting parents in the areas of play, providing some support in terms of maternal well-being. So we did a cluster randomized controlled trial. The study is just finishing up. We haven't analyzed the data yet, so unfortunately I don't have any results to present. But one of the main aims of that study obviously is to evaluate the impact of the program. A novel aspect of the study, we've incorporated EEG and eye tracking measures into the study. So Amanda Tarula, who will speak in a minute, is leading the EEG component. So I just want to highlight this is a study, a project that is already interdisciplinary and sort of is an example, I think, of what the Institute is also aiming to catalyze going forward. In addition to the trial aspect of it, we have funding from NIH to focus a little bit more specifically on biological mechanisms. So for a subsample of children, we've collected blood and we'll be looking at the relationship between micronutrient status, inflammation, and neurodevelopment. I should mention, I noticed my colleague David Hamer is in the back of the room. He's also a co-investigator on this study. Good to see you, David. And so like I said, we'll be analyzing the blood, some blood samples we collected, and looking a little bit more mechanisms, trying to understand mechanisms, very important to understanding how the interventions work and designing better interventions in the future. The last thing we want to do is establish a cohort. The children right now are about to turn 4 years old. We're putting in a grant tomorrow, hopefully, to NIH to fund a follow-up wave with the children. So when they turn 5, we would be looking to measure executive functions to try to understand how some of these early markers of neurodevelopment predict potential executive function outcomes later on. And we would hope to follow the kids throughout their life if possible, but definitely into the future. So I will pause, or I will stop there, and look forward to seeing you all at the TAP part of the session. Thank you.